What's up, guys? So last week I was able to interview Doctor Robert Bransfield, who I'm also fortunate enough to have as one of my doctors. So before I post the interview, I just wanted to list some of his credentials so you guys could understand how knowledgeable he is in the field of psychiatry and mostly surrounding the subject of tick-borne diseases and how they relate to psychiatric conditions, neurological conditions, and other developmental delays and things like that. So, Robert Bransfield is a psychiatrist with extensive experience and training. He graduated from George Washington University School of Medicine and completed his residency in psychiatry at Shepherd and Enoch Pratt Hospital. He is board certified in psychiatry by the American Board of Psychiatry and Neurology, and he's also a clinical associate professor at Rutgers University, RWJ Medical School. So he knows what he's talking about, and this topic is like super fascinating when you start to understand how this all works. And he's kind of the guy to talk to about this stuff. So, without further ado, I will get to the interview. Also, it's my first time interviewing anybody, so be nice. Let's go. First, I guess I want to know, how did you get involved in psychiatry around tick-borne illness?
Well, I treated treatment-resistant illnesses, people that weren't responding, and a lot of them ended up with infectious disease, and that's why, you had to look at it from another angle.
Okay.
And and then, once I started seeing it, then I realized, gee, I've been overlooking this, and it gives new options for treatment.
Okay. That actually that leads me to another one of these questions I have. So tick-borne illness manifesting psychiatrically is sometimes known for not responding normally to treatment with psychiatric medication, and so higher doses need to be necessary. So you've come across that?
People need lower doses, but it's but sometimes you need the antibiotics, okay?
Instead of psychiatrics, right?
Well, you often need both.
Okay, yeah. In one of these articles, it says patients that have been mainly treated with psychiatric meds often need antibiotics, and vice versa.
Yeah.
So you were actually an expert witness in a couple cases involving like suicide or homicide.
Yeah.
So can you speak to the relationship between Lyme disease and I guess violence?
Yeah, in fact, well, put it this way, I'm doing a thing on it at 3 o'clock tomorrow. It's out of England, out of AONM, Academy of Nutritional Medicine. So you could watch it if you want, and there's a Q&A, okay?
Yeah, how do I watch that?
So look up Academy of Nutritional Medicine.
Okay.
And it's do AONM in my name, and you'll probably find it on a search.
Okay.
And I'll be doing a thing, and I'll be talking about my latest article, which is looking at how infectious disease can cause global instability.
Oh, interesting.
Like causing mental impairments.
Right. Okay, cool. I have been waking up in the middle of the night or having trouble going to sleep after I do some after I like up my other doses of the antibiotic herbs. But
yeah.
I noticed that if I take ivermectin, I can fall asleep like no problem. Like, I was wondering if you think that has anything to do with like the way it kind of works on the immune system and like calms it down a bit.
Listen, I think ivermectin's a wonderful drug, and there's a lot of different ways that it works.
Yeah.
And people have used it with Lyme disease, and you think of it as kind of anti-parasite and antiviral.
Mm-hmm.
And people were using it in Lyme disease before they were using it for COVID, right?
Yeah, that's how I started using it.
Particularly with Magellan's cases. And then there's all this anti-ivermectin, propaganda.
Yeah, that really made me question a lot of my political leanings and stuff when that came up. It was very interesting.
Yeah, it's one of the safest Nobel Prize winning drugs in history. And why discredit it,
Yeah.
But it seemed like it sort of was a threat to the vaccine industry.
Definitely. So when I went to pick some up the other week, I had to pick it up at Walgreens because
Yeah.
2 years ago, CVS told me they wouldn't honor my prescription. And then Walgreens last week said, we aren't stocking the drug anymore. And I thought, why would they do that? Because it's on the essential list of medicines. Why would they not stock this drug?
Somehow that's happened with a number of pharmacies. And, somehow it's like there's some way got influenced. It's crazy. But it happened,
I had a couple more questions about neuroborreliosis specifically that I hope you could answer.
Go ahead.
So I was learning about how in neuroborreliosis there becomes like an excitotoxicity basically, which is
right.
which becomes like a brain injury.
Right.
So will that go away with treatment of the disease?
Yeah, that's the goal, and it goes in more of the pro-inflammatory cascade and, oxidative stress, excitotoxicity. That's kind of the final pathway of how neurodegenerative diseases can work.
Mm-hmm.
But if you reduce a lot of your symptoms are immune-mediated.
Right.
So it's a matter of sorting that out,
So now, I guess since neuroborreliosis is Borrelia infecting the central nervous system, will oral...
Well, make a distinction. You can have Lyme in your body that activates the immune system, and that immune activation gives mental symptoms.
Okay.
You can also have Lyme in the vasculature of the brain or other tick-borne diseases, and I'm talking that affect the brain, okay?
Yeah, like Bartonella, for instance.
We're not just talking about Lyme, we're talking about other tick-borne diseases too. Or you can have it actually inside the brain. But most of what we deal with isn't infection in the brain itself. It's infection in the body that activates the immune system, which in turn affects the brain.
Oh, okay. So
neuroborreliosis is when it's actually in the brain, but a lot of what we deal with isn't actually neuroborreliosis.
No, okay.
Or chronic Lyme or chronic tick-borne disease in the body activating the immune system that gives mental symptoms.
So how would you be able to tell the difference?
Well, you when it's in the brain, you'll see more neurological symptoms, like cranial nerve symptoms. You see a lot of like what we call meningitis symptoms.
Oh, stuff like that. Okay.
Spinal tap might show it. Okay, but you see more neurological symptoms than when it's more the inflammatory, the immune reaction.
Right. So, okay. So if it was in the central nervous system, do oral antibiotics and herbs still work, or would you need to do like IV treatment to target that?
Well, I think to start with the orals and work your way into it gradually, because if you start too aggressively, then you can get too bad of a Herxheimer reaction.
Yeah, I've had that. Yep.
So if you get much of that, then go there gradually. And then work your way to the IV if you need to. Or the IV is useful if you have a very sensitive stomach and your stomach has trouble tolerating oral antibiotics. Right?
Yeah, and then you can bypass that and keep your microbiome intact.
Yes.
I'm wondering, like, how prevalent do you think these stealth tick-borne infections are in individuals with some type of mental illness?
I think there's a lot of it. I think a lot of it could be Bartonella or toxoplasmosis or other things, and I think it explains a lot of mental illness. That mental illness isn't just genetic. There's an environmental trigger, and I think these are the triggers.
Yeah, that's what I've been.
I think it explains a lot of it.
I do too. So, yeah, and not just in America, but also like globally.
Yeah, well, that's what I'll be talking about tomorrow.
I'll make sure to tune in.
Talking about certain areas of conflict in the world where there's infections that make people violent, and that's why those parts of the world have conflict. Okay.
Oh, wow, that's incredible.
Yeah.
Wow.
For instance, there's more infectious diseases by the equator, and there's more violence by the equator. Countries with more infectious diseases have more violence.
I never thought of it that way. That is...
Well, that's what the talk will be about, okay? And I have a journal article on that. You look up Bransfield and infection and global instability, you'll find it.
Bransfield Global Instability.
Yeah, infectious, violence and global instability, okay?
I'm just writing this down real quick. Infectious.
Bransfield, infectious diseases, mental impairment, violence, and global instability. You'll find it. Okay.
Thank you. Okay. That's a good one. So, if patients that fully recover from these tick-borne diseases, or the disease is weakened enough to go into remission, will they be able to come off the psychiatric medication?
Sometimes not. Depending on how much permanent damage was done. Right.
Is that permanent damage from the excitotoxicity or something else?
Yeah, it's if you treat it successfully, you may stop further progression, but it may have harmed certain brain circuits, and once it's harmed it, you can't totally reverse all that's already been done. Maybe
right.
Some, but not all of it.
Okay. Do you think that post-treatment Lyme disease symptom exists?
No, it's a bogus term because people need further treatment.
Okay.
Right? You can't say post-treatment, even if it's not antibiotics. And how can you say it's post? Because you have no way of knowing it's gone.
Okay. So you think it's
right?
just chronic Lyme, basically?
Well, sometimes, if it isn't always chronic, sometimes it's still in the body.
Or just, okay, so it's just like Lyme in general.
Lyme can be chronic and it can be relapsing, remitting, okay?
Right, but so the post-treatment thing is just not really a...
That's BS, yeah.
It's really just the patient is still sick.
Yeah, how can you say it's post-treatment if they're still sick?
Yeah.
Makes no sense.
How would you differentiate between a patient with psychiatric symptoms between Bartonella and something like neuroborreliosis or just Lyme?
It's hard to tell, and a lot of times you have both.
Right.
A lot of times you have both, okay?
Do you find...
So Bartonella, you may see the stretch marks, the lines.
Yeah.
You may see tenderness in the feet and shin pain. And you might see a lot of the violence may be more Bartonella than Lyme.
Right. I've thought that too.
Yeah, it does seem like most of the people that have the more significant symptoms really have the Bartonella, the Babesia, and Lyme, the big three.
Yeah. I had significant Babesia symptoms about 6 years ago, like the air hunger and all that stuff.
Yeah, that's what makes you think Babesia.
Yeah, but I did some treatment for like a month and got rid of that. It wasn't too bad.
That's good.
Yeah, but that was an interesting one for sure. Do you ever prescribe antibiotics, or are you just doing psychiatric treatment?
Occasionally I do, although a lot of times I'm working with someone who's prescribing them.
Oh, you're working
You
in
know?
conjunction with another doctor?
Yeah.
Okay.
And sometimes, like if it's a psych patient and they're not working with a Lyme doctor, I may think, well, gee, maybe we'll try some antibiotics and see if this helps the psych symptoms. Right?
Do you have any like favorite ones that you would use?
I think Septin's good, and Zintramax is pretty easy on the stomach, and I think disulfiram is good.
Oh, really? I wasn't expecting that. I had tried minocycline before, and
Yeah.
that gave me a significant herx where like it made me want to like die basically. Would you say that it was working pretty good then, or?
Well, it penetrates into the brain more,
Yeah.
so it could suggest that maybe you do have something more within the brain. Okay.
I'm thinking about revisiting that one eventually because it seemed to do a lot more than any of the other ones I've ever tried.
Yeah, but go into it gradually with a low dose. Okay.
Yeah. Yep.
Go into it gradual.
Okay.
Okay.
I'll if I ever do that, I will I'll talk to you more about that.
Yeah, and if you get the Herxheimer reaction, don't keep taking it. Wait till it dissipates before you take your next dose.
Okay. Yeah.
So go low with the dose in general and easy, and increase it very slowly so you don't get that real bad.
Mm-hmm.
Okay?
Okay. All right. Well, thank you for your time.
All right, take care. All right, bye.
See you. All right, guys. So that's that. That was Robert Bransfield. You can find his publications on PubMed, Psychiatric Times, some of the other things, some of the other articles he's written are out there on the internet. Just Google his name. He said he is doing a live conference through the Academy of Nutritional Medicine tomorrow at 3:00. By the time I post this, it will have, you guys won't be able to see that live. But that's on the effects of infectious disease and violence around the world, which he's saying is closer to the equator. You can look at the data and see that all around the equator there's more violence, and he's postulating that that's because of the prevalence of infectious disease in that area. Because we know that these infectious diseases do create violence if they are able to get up near the brain, and that's just how they work, so they will do that. Something else you could search up would be, he mentioned this during that call, there's an article on the global instability involving infectious diseases and mental impairment. Check that out. That's also his name again, Robert C. Bransfield, if you want to look into that. Thank you guys for listening, and I hope you were informed of some things you probably didn't know about, and together we're going to bring more awareness to this and make this a big deal that people can't just keep ignoring. You know, it's going to be so out there in the front that you won't be able to look past it. So that's my goal. That's my hope, and I hope you guys can help make that a reality with me. So if you would like and subscribe and share this video, and stay tuned for more. All right. So thank you for being part of this. Bye.